has been another milestone day for Wisconsin, and not in a good way, as the pandemic rages on.
Wisconsin health officials are reporting more new cases of COVID-19 than any other state in the country. Here to discuss this story and other coronavirus headlines, Dr. Zorba Paster, who will be taking your questions later on as well. Hi, Zorba.
Hi, good to see you guys.
Bad statistic. We lead the country in total cases today.
So not per capita, right?
Not per capita.
We lead in the country, not per capita, but in the total number of cases. So we are, for instance, 1/8 the size of California, yet we have more cases than California. And that's, among other things, because we are not wearing masks, because we are not social distancing, and because we're going out to bars and not paying attention to public health. And it's awful.
They're saying most of the cases are coming from private gatherings, parties in people's homes. And
right, exactly, because people are not taking it seriously. They're not taking it seriously, and if we don't mask up, we're going to continue to lead the nation in COVID, and that is not a statistic that any of us want to know about.
Not at all.
No, not at all. No. There have been a number of interesting studies that have come out this week regarding COVID-19, and one looked at cases in daycare centers. What was that about?
Right. Well, this is a very interesting study that came out of Denmark. Denmark, as you know, there's one insurance company, and that's the country itself. And they looked at nearly 500,000 cases of COVID, and then they looked to try to find out whether or not daycare centers were responsible. And lo and behold, they found out daycare doesn't seem to be responsible for the spreading of COVID. And that appears that little kids, small little kids, don't seem to be spreading it to adults. They're not exactly sure why. They think it might be because they're closer to the ground, so they're not getting the droplets that are spread by people who have COVID. They're closer to the ground, so they're not spreading droplets to adults that are higher to them, or it may be simply be to the immunity that little children have. But it's quite interesting, and it really is very important because it seems to show that daycare centers opening may be okay for society, and that's a major, major issue for many, many people who want to go to work and want to bring their child to daycare. So I think this information that's come out of Denmark is really very important and very useful if you're deciding whether or not to send your child to daycare.
Yeah, very important indeed. Also, a new study about your blood type may lessen the severity of the disease.
Right, exactly. It was really thought initially that blood type may be an issue, may not be an issue. There was sort of a plus and minus about it. But now it seems the data seems to show that if you are O, whether you're O positive or O negative, you may not get COVID, and you may not get COVID if you do get it as seriously. If you're A blood type or AB blood type, you appear to be a higher risk to actually get COVID, a higher risk to be needing hospitalization, and a higher risk to actually have to go onto a ventilator. And so all those things are really important to know about. It's not as if O keeps you from getting COVID, but it means that if you're A or AB positive or AB negative, that you may be more likely to get COVID and get it seriously.
We learn something new every day.
Very interesting, yeah.
All right, we're going to take a break, but take your calls coming up. 270-9933 is the number to call to talk to Dr. Zorba Paster. 270-9933. We'll be right back.